Okay, great. Well, thank you for inviting me. And I love what you all do. I'm so grateful. NAMI is all about partnering and bringing everyone to the table. And we love what you do for our community. My daughter's pre-med. She got into 3 medical schools, hoping to get into JABSOM, but crossing fingers and praying. But anyway, we just love what you folks do. So thank you very much for taking time out. My name is Kumi Macdonald. I am the Executive Director of NAMI Hawaii State. NAMI is the National Alliance on Mental Illness, and we provide support, education, advocacy, and awareness for mental health, for family support, for people living in recovery, and general education for schools, churches, and faith communities. And that's the area that I wanted to highlight today, that as we are going into the holiday season, and we all have different faiths, and that's wonderful, how does faith intersect with mental health? And that's what I'm going to be sharing a little bit about today. So Bridges of Hope is a NAMI signature presentation from NAMI National. And it started sometime back in 2017, but I know that the faith movement within the NAMI community started back in 2014, and I'll go a little bit into that as well. So I just wanted to mention that I am not getting any financial gain. I think I have to mention that, right? So just saying that we are not gaining any financial interest in this. NAMI is 100% free, nonprofit. We provide free programs across the state and across the nation. So we just want to let you know that we're here to partner with you as medical professionals to provide these free services to our community members or family members that are caregivers. All right, so I'm going to be doing a condensed version of what we present to faith communities, and NAMI Bridges of Hope is a presentation where we take it into different faith communities. Again, we're not pushing religion, we're not pushing faith in any capacity. What we are here to do as a national mental health organization is to provide these resources, to provide the connection and the bridge, so that people of faith communities can go, oh, NAMI's here. That's right. NAMI provides support groups. NAMI provides classes. So we are an interfaith resource, and it's made of national members, clergy, people of faith, and it's of all faiths. And then what we do is we are encouraging faith groups and communities to have a welcoming, supportive atmosphere within their congregation or their faith practices. And we are here to also provide information for people who identify with the faith. So some people have trauma regarding their church of origin or their faith of origin. So we're not talking about that. It's just for people who identify and say, you know what, faith is part of my journey. Faith has helped my family in the recovery process. Faith has helped me personally in my recovery process. So that's what FaithNet does. All right. So I'm going to, again, this presentation is what we generally present to these faith communities to explain what we do and how we partner with them. So I'm going to do a condensed version of that, and then we'll go into some more local programming at the end. So what we talk about here is, what is mental health? Why is faith and spirituality important for people affected by mental health conditions? And what can you do to help as a congregant or a person of faith or a person in your community? And those are the things we address in this presentation. So we talk about that, 20% of youth ages 13 to 18 live with a mental health condition. 50% will be affected by a mental health condition in their lifetime. We just go through stats, but I know you as medical professionals know all about that. We talk about 1 in 5 people living with a mental health condition. We also mentioned that during the pandemic, it was 2 in 5, right? Because we did notice a big jump, and we still see the after effects of what's happening. We know that a lot of people are still having a hard time getting back to school, getting back to work. We notice people aren't going back to work. Kids are, I was on another Zoom meeting yesterday with another medical doctor who said childhood obesities and other related illnesses are on the uptick, and has a lot to do with our mental health. Okay. So at this point, we asked someone to give a personal story, but as you know, even today, I think we kind of have a lower turnout, but um, normally we invite one of our faith net program leaders to do a story, but because of the holidays, they're traveling or they're on break. So I'll give you my personal story. So for me, I grew up in a church community, and I did grow up with my own personal mental health story. So when I was about 9 years old, I had my first episode of an anxiety issue, and it was like a small panic attack. And also around that time, I also had some OCD tendencies. And I remember going to my mother and saying to her, Mom, I think there's something wrong with me. And I remember at that time, you know, way back in the 70s, we didn't talk about mental health, especially being an Asian American person. We just were taught to suck it up. Gaman is what we were taught if you're Japanese, right? And so I was often taught to just kind of, you're going to be okay. If you can verbalize it, you'll be fine. And so basically, it was a message of don't talk about it. You'll be fine. So also being raised in the church, I had a father who was a Christian pastor. And so, you're kind of in a fishbowl. Everybody's always watching you as the pastor's kid. And so you have this, not only was I a minority trying to be a good example in my community to represent Japanese Americans, but also as the Christian pastor's daughter, I had to present myself as, I'm good, great, the joy of the Lord, yay, right? But in reality, there was a lot of inside struggles. So it wasn't until I was about my late 30s, after the birth of my last child. With each one, I had a little bit of the baby blues, but the third one was, I think, the hardest. And so after that is when my PCP, great doctor, I love her to death. She said, Kumi, what's going on? I said, well, I'm just a little bit dragging, a little depressed, but it's okay. That's just life. And she said to me, it doesn't have to be that hard. That was that one little statement that made me stop and think, really? Sure, Kumi, it doesn't hurt to try a low dose antidepressant. And I was like, really? Like, it was very revolutionary for me at that time. And she was not only my doctor, but she was also a dear friend from my own personal church, Honolulu Christian Church. So she was not only a friend, but a really great doctor. And so I started on low dose antidepressants that got me to the one step of energy, one level of energy. And then I was able to go, wow, I can exercise. Okay, next step. Wow, I think I can go find a counselor. I can go back to my women's support group. I can go back to church. I can go back and do the normal things. So it really was that medical doctor that kind of just bumped me into the mental health recovery. And faith plays a large role in my recovery process. So I do stay plugged in. I start my morning with prayer and meditation, reading my Bible, listening to music, and staying connected to my church community, my women's group, and always just practicing gratitude and all the wonderful things. Whether you believe in faith or not, all of those things are good, right? Meditation, gratitude, listening to music, all of those things. So, that's my personal story. All right. So these are the symptoms that we talk about. And of course, you as medical professionals would know all of that. So I'm not going to go into detail. Basically, when we talk to lay people, we just tell them, look for anything extremely out of the ordinary that's persistent. So, people ask often, when do you know somebody needs help? Well, if it's interfering with school, relationships, or joy in their life, that might be a time to at least check and see if they might be able to get some help. All right. And then we also talk about there is hope in living with mental health conditions. I think a lot of times in churches, and grew up in a church, we were often taught, oh, you have to just be joyful. It's almost like we weren't allowed to be sad at times. The language is totally changing now in many churches, in many temples, in many faith communities. But, there was a time when people were not allowed to talk about their mental health conditions. So we want to tell them that there is hope. There are people who care. And there are a lot of spiritual questions that people have, whether you are a person of faith or not. I think a lot of people going through mental health conditions often might ask some of these questions. Where is God in this? Why do good things happen to bad things happen to good people, right? And why do good things happen to bad people? That too. What have we done wrong? And how can my faith help? What's next? So some of these things are things that I think many of us have thought about at one time or another. And it's not for us to tell them what that answer is. It's for them to just know that there's a support group, a support team that will help them through that journey. So why do faith communities have a role in the mental health recovery? Well, it's because that faith communities are one of the first places people turn to in crisis. Many people, before going to see mental health providers, they will seek somebody in their church or a faith leader or a mosque, a temple, to get help or support, emotional support. And we know that oftentimes churches will call us because they will have a large homeless community come in for help, or people who are struggling with their mental health come in for help. And then the faith community says, I don't know how to address that. And that's why they partner with us and we give them this presentation. And, I guess a lot of people see that beacon of hope. If you think back in traditional America, way back when, in the frontier period, the only place you can find any help in the olden days was to look in a small town and look for the tallest building, which was a steeple, right? Which tended to be a church or a school. And that was a place where you can probably ask for help if you were lost, or if you were, homeless or starving, you go and seek refuge there. So, that's what we want to be, is that people come to faith communities for help, and we want to be able to be ready with our information. Okay. So what can we do, you, me, everyone else? How can we help in this? And how do we act on this, right? So that's what we're here to do, is to teach our faith communities. First, we learn the language of caring and acceptance. And I think even as medical professionals, like you probably have heard this before, good bedside manners, right? I have been to doctors who did not treat me kindly. And there were some, like my personal, my PCP, who was very caring and accepting. So that's the language that we're trying to teach community members, is that we're not here to judge. We're not going to give them quick fixes. We're not going to be giving them quick answers, but we're going to just say, we are here for you. How can we help? And then being ready with examples of help. All right. So these are some tips that we give individuals, and how to reach out. So it's a good, place to start, to just say, hey, I'm here for you. And just moving in with gentleness and kindness, and then offering support. How can I help? How can I pray? Instead of saying, oh, just be happy, just be joyful, oh, be positive, that doesn't help. It's, how can I help? How can I pray for you? those are the appropriate answers. So these are some things that also we encourage faith communities to practice. And you notice that even in work or a faith community or a club, if somebody's sick, let's say somebody has a heart attack, what do? We go, oh, okay, we're going to have a sign up sheet to deliver meals, right? Or we're going to get a card and everybody in the office signs it. Or we're going to send a fruit basket or whatever that might be. But when somebody has a mental illness, oftentimes those things don't get done. Nobody visits them in the hospital. Nobody brings them a fruit basket. No one brings them a card. So we want to teach people that mental illnesses are real illnesses, just like heart attacks, cancer, strokes, mental illness, and crises that happen are medical situations as well, right? So we want to always teach them that when you talk about somebody with a mental illness, we don't call them schizophrenics. We don't call them crazies. We call them people, right? People first. A person with schizophrenia, person living with bipolar, a person with anxiety disorder, right? Some other things that we would like to encourage is for people to check in with the person or their families. We want to let them know that not only is the person in crisis, but the entire family is in crisis. The entire family is affected by the illness. And I'm sure you know all the science behind that, right? Whether it's obesity, heart disease, whatever, it's the whole family has to be around it, or that individual's not going to completely get better, right? Ask them what would be most helpful. So for me, I remember when I was struggling with my own depression or anxiety, and people go, what can I do to help? I'm here to help. That doesn't help me at all, because when somebody's depressed or anxious or going through a mental health condition, that's the last thing we can do is make one more difficult decision or one more considerate decision. So one of the most helpful things was when my friend said, I'm bringing soup on Sunday, be ready for me. And she brought me a big pot of soup, and that fed my family. That was one thing I didn't have to deal with. Real blessing. One caveat to that was I did have to wash the pot, find out when she was home, and then deliver it and put another gift in there and deliver it. So one thing is, if you do bring a meal for someone, bring it in a disposable container, because that's one less thing for them to have to manage. Also, if you see right here on my background, there's the book, I Am Not Sick. No, the book's called You Are Not Alone, sorry. That book also talks about individual stories of what family members said worked and doesn't work. Individuals share their story, over 131 interviews in this book. And one of the things that I liked the story was there was a support group in the family says, my kid has mental illness. How am I going to get through it? And one of the people in the support group said, the answer is paper plates. And I was like, I love that. I love that. It's like, so what? Let the house go. You don't have to use plates. You don't have to worry about washing dishes. Paper plates, right? And have your friends bring your meals in disposable containers. Okay. The other thing that really helps is prayer. Making sure you talk about it and making an effort to understand them and listening. Offering prayer, very awesome. Place to belong, whether it might be a support group or a fellowship group. Cooking a meal, running an errand, planning a home visit, and learning about the illness is so important. So the more somebody learns about the condition, the more you show that you care. So my uncle was just diagnosed with Parkinson's. So I did a whole reading up on it so that I know about what's going on with him, right? My mother had 2 mini strokes last month. So she had a major stroke 6 years ago, but then she had 2 mini strokes last month. So now I'm reading up on what are the outcomes of that and what are the progressions on that. So learning about some kind of an illness, about someone you care about, shows you care, right? And then always show that you accept and show compassion. All right. So this is an example of a church that took some of the things that NAMI does and integrated it into their church community. So Saddleback Church was started by Rick Warren, and Rick Warren was the kind of like the celebrity pastors. He wrote the book Purpose Driven Life, which was on the New York Times bestseller list, I think, for over 10 years. And he has this big mega church in Orange County. His son died by suicide. His son died by suicide in 2013. And it really impacted him. I mean, he had the resources, he had people in his church that could help. He knew the president. I mean, he knows Oprah, he knows everybody. And yet his family was devastated by mental illness. And when that story broke, that really affected me. Back in those days, I was still working in a church and as a program director there. And I remember seeing that email and breaking down, weeping in my office because my son was having suicidal ideations at that exact time. And I said, my son's struggling, I'm struggling. How can we help people in the church? And then Saddleback came in and had their first mental health conference for people of faith with over 3,500 people involved, which was the first of its kind. It kind of made big news, like CNN News and everything. And then they started this program. And Hope for Mental Health talks about little tiny, oh, I guess I don't have that slide, but it talks about you can take little steps. It's called crawl steps, walk steps, and run steps. So if you are a faith community just starting out and said you don't know what to do, just start small by just praying or providing encouragement or going up on your church Sunday mornings and saying, today we want to uplift people who are going through mental health challenges and we want to lift you up and pray for you. Something as simple as that, right? Showing you care, right? Bringing in a speaker like somebody from NAMI or Mental Health America, whomever it might be, to talk about mental health. So those are crawl steps. Walk steps would be invite a NAMI support group to hold support groups in your church, or invite another mental health professional to come and give a talk and do a little workshop on a Saturday afternoon. So that might be a walk step. And then the run step would be like this church, how they have clinical counselors on their staff who are trained to do that. They have actual mental health support groups. They have NAMI classes, NAMI support groups, all kinds of stuff happening in their church. So take a look at that if you're interested. All right. So these are some of the faith projects that,
we have a couple comments from Dr. Weir. He just wanted to note on the importance of laying on of hands during prayer when you were going through that list, and also that disposable containers are great, but maybe even follow-up visits to go and retrieve the containers might be nice too.
I love that retrieving of, yes, that would be great. So, okay, I will come tomorrow to pick it up. That's a great idea. That's a
No need
follow-up.
to wash it. No need to wash it. Yeah.
Yeah. And then the laying on of hands. Yes. In my faith practice, yes, we do lay on of hands because not only is it a spiritual practice, but also just the touching of someone, right? Even in medical, right? Science shows, right? Just touching someone, there is a healing effect of that. So, yes, I agree with that. In my faith practice, yes, we do lay on of hands because it's more of like a spiritual anointing that comes through people. So again, it's on depending on different churches, different faith practices. Did I answer your question? But again, we don't dictate what the spiritual practice should do. That's up to the church. What we are here is we're just here to give you resources and information.
And Renata has a question. If it's not progressing through those steps that you spoke about, what can we do to initiate and motivate?
Oh, you mean if somebody is not wanting to get help? Is that what you're talking about, Renata?
Or are you talking about the organization itself going through the crawl, walk, run steps, or the individual, Renata? Maybe we can come back. Oh, no, if they started the process but are still stuck. So the individual.
the individual, right? So, again, if if the person is living in recovery and they're stuck, that's what NAMI comes in to do, right? What we do is, and I'll explain a little bit more about our programs at the end. Tell me if I'm running out of time, okay? All right, so these are some of the projects that we've done with NAMI Hawaii. And so we've gone to churches and done small group Saturday workshops. We taught churches how to work through a crisis, how to communicate. We've also done topics on healthy mind, body, spirit, because a lot of people don't want to learn mental illness. But if you rephrase it and say, come and learn about healthy mind, body, spirit, they go, yeah, we all want to learn about being healthy overall as a complete being. And so that was a really good turnout. Um, I don't know if you know about Hawaiian Islands Ministry, which is the largest Christian conference here in the islands. So NAMI Hawaii's partnered with them for their mental health conferences. We work with Mental Health America, bringing training to churches. We've gone to morning services. We have support groups, family to family education at churches. And we have currently one faith support group and two more coming up, starting up in 2020. All right. So I will address your comment, Renata, in this upcoming slide. So learn more about what NAMI is. You can go to NAMI.org to learn more about FaithNet and other NAMI resources. We also have a local website, NAMI Hawaii, which is more specific to our island programs here. And we are over 600 affiliates strong across the nation, founded in 1979. And we are, here again, we're not a religious organization. We are an evidence-based mental health organization. And part of what we're doing is that we do partner with faith communities. All right. And what can you do is that each of you, whether you are an individual, a family member, or a provider, we can stand together to make a difference in our community, right? So you can learn more by going to NAMI.org/FaithNet. And then these are our current programs. So addressing Renata, what we do with NAMI is a lot of people who have anosognosia, which is a mental illness where they can't really see that they are ill, correct? So what we provide are classes for the family members. If the family members change their approach, like I'm a mom, my daughter had her own struggles, my two sons had their own bouts of depression, anxiety. And so as a mother, if I say, come on, get to work, go to school, go to school, go to school, which is what a mom does, that's not going to help my son when he was having suicidal ideation. And so what I had to learn, taking the family to family education, is I had to learn to understand his perspective, how to communicate. And we teach families step by step how to communicate, how to empathize, how to set boundaries, how to find a therapist, how to work through a crisis, how to prepare for a crisis, and all of these wonderful things, step by step, evidence-based education. That's called NAMI Family to Family. And so we can bring these into the church community. It is an 8-week program, but currently we've just been doing it on Zoom. Family and Friends is a shorter version of that. It's a 2-part, a mini version of that. And then peer-to-peer education is for persons living with mental illness in recovery. It's a step-by-step 8-week course on how to better advocate for yourself, how to prepare to see your doctor, how to practice self-care, how to surround yourself with people who will be your support network, and so on and so on and so on. And then we have all these wonderful support groups and speakers bureau. And then we also train the police, which is the CIT crisis intervention. Again, we work with the churches and we invite everyone, whether you're of faith or not faith, anyone who might be your patient or family members of patients, to join our classes. Everything is free statewide. Majority of our programs are available on Zoom. Okay. And these are great resources. Like I said, if somebody went through these steps and they're still not getting the right help, there's a whole bunch of good resources here, including a book called I Am Not Sick, I Don't Need Help, a free excerpt on how to communicate with someone who has mental illness. Again, all that's on free on our website. And this is some ways to get help. Again, I think, oh, I want to say one more thing was that we do have a conference coming up in early spring, ending of March. Our tentative date is March 28th, free conference, and we're going to be addressing NAMI Hearts and Minds. This is a brand new program developed by Dr. Ken Duckworth, our Chief Medical Officer, on how physical health and mental health go together. And so it's hearts and minds. And we'd love to invite all medical professionals for that. Hopefully, we're going to be able to get some CEUs available for that. But again, we're still in process of planning for that. So these are some things that you can learn from Hearts and Minds, gut health, physical health, and how to advocate for your health. And that's the end of my presentation, but I wanted to open it up to any questions that anyone else may have.
Thank you, Kumi. Any questions about NAMI or FaithNet or anything discussed? Renata, did your question get answered? Thank you. So that's super interesting. You folks can go out and work with churches and give presentations during a service and things like that.
Yes. So, I mean, we've worked with different church communities, but also with the Buddhist community. And so whatever group, whether you're in non-religious groups, maybe it's a youth group, a YMCA group, an exercise group, whatever it may be, we do have speakers that can come and speak to your group. So we speak yearly at JABSOM and some of the UH groups, social School of Social Work. And so a lot of agencies and schools and organizations will invite us. So please know that we are available free of charge, and please email us if you have any questions.
Thank you. And Renata says, yes, mahalo, you answered her question. And is that on all the islands you folks are available or just Oahu?
So we are statewide. So we do provide services across the state, but we have in-person affiliates on Oahu, Kauai, Maui, Big Island. We want to connect with somebody in Lanai Island, Molokai, the other islands. If you know of somebody there that would welcome some education or some support regarding mental health, let us know. We'd love to work and partner with clinics and practitioners and schools, etc.
Perfect. I'll share your information with some of our partners in Lanai and Molokai.
Yeah, thank you.
Any other questions today? Did you get to share about all the programs? I know you went into it a little bit with Renata and then deeper, but are there any other ones that you didn't mention in the presentation?
Oh, well, let's see the book. You see this book here? You Are Not Alone. That is our new NAMI book. And you can get it on Amazon, but it's really a really good comprehensive book on the top medical professionals from across the nation. And also has 131 interviewees all the way from New York, all the way to Hawaii, and just practical information on mental health and recovery for family members and individuals. Also, there's a new book coming out next year on You Are Not Alone for parents to children, because we do know that children need a lot of mental health support. So this book is dedicated towards adults. The next one will be dedicated towards parents of children.
And that's available on your website.
This book is, you got to buy it through Amazon.
Okay.
Amazon.com. And if you would like to pick up a copy from the office, email us, and we have a few copies in our office as well.
Okay. I would look for the link and link it on our resource page as well. Hank has a question. What do you think are the likely effects of telling psychotic patients about invisible beings like devils and demons and hell, etc.?
Okay, that's a good question. So what NAMI's perspective is that we never deny that person's experience. If you're a mental health professional, maybe you have a different perspective, but we never tell people what to do. We never deny the truth for that person because what they're experiencing is their experience. So we never say, oh, there's no such thing, right? So NAMI, our language teaches is we just say, wow, that must be hard. Wow, that must be tough if you see demons and angels. That's how we kind of teach it in our curriculum, is to just empathize with people, not to devalue their thoughts and opinions, because who knows, what if they're right? We're the ones that are wrong. We don't know that. Because like I heard from, Castle Medical Center, one time I was getting a tour and they said, we arrested this one young kid. He kept telling us he's an undercover cop. He's an undercover cop. And we're like, oh no, he's delusional. And we kept him in there for 3 days. Sure enough, he was an undercover cop. So one in a million times, you just never know. They might be telling the truth.
It's true. Oh, Renata would like to know if you know the title for the book that's coming out for the families, the
I
parents.
believe it's something similar to this one. You are not alone. And if you would like to be on our email list, send me a shout out in an email, and I will definitely put you on our email list so we can keep up to date with our upcoming conference, our upcoming programs, and the release of the new book. Also wanted to mention that new classes will be starting up in early 2023. So again, if you want that information for your patients and their family members, again, let me know, email me, or put it in the chat and we will make sure you're on our email list.
And are your support groups or classes, are they via Zoom or are they face to face or both?
So we have both. So most of our support groups for individuals living in recovery are on Zoom still. We have one in-person recovery for persons with mental illness. FaithNet is on Zoom, but 2 more will be starting up in 2023, which will be in person. And then family support groups, I believe 1 in Kailua is in person. The rest is on Zoom or hybrid.
Okay, thank you.